Good day, I'm Nanthinee Subramaniam from CNA. The headlines: Make vaccinations compulsory, says MMA. The Malaysian Medical Association (MMA) has stressed on the need to make vaccinations compulsory for all Malaysians in the wake of a polio case in the country, 27 years after it was eradicated. Its president Dr. N. Ganabhaskaran yesterday said the national immunization program should be made mandatory. He said while the case in Tuaran Sabah was an isolated one, parents should get their children vaccinated as a preventive measure. MMA is saddened to learn that a 3-month-old Malaysian baby boy is suffering from polio. Polio is a vaccine-preventable disease. The immunization schedule in Malaysia, which includes the inactivated polio vaccine, is free for all citizens and contains a list of recommended vaccines from birth to 15 years of age. However, none of the vaccines are mandatory, despite all of the diseases being either life-threatening or potentially crippling. MMA urged the government to consider making vaccinations mandatory. As with most countries with a national vaccination program, a National Vaccine Injury Compensation Program (NVICP) must also be in place. He said disease control at border posts was important to prevent highly infectious viral diseases. He said while border control needed to be improved to prevent an outbreak, access to healthcare must also be available to all. This, he said, included the stateless, undocumented refugees and illegal migrants in line with the principle of universal health coverage of leaving no one behind. The NVICP is the first ever United States no-fault compensation system for patients or their families who suffer serious adverse reactions from required childhood vaccines. By removing most of the liability burden from manufacturers for immunization-related injuries, the program was expected to help stabilize the supply and price of vaccines. The NVICP was established as part of 1986 National Childhood Vaccine Injury Act. Dr. Ganabhaskaran said MMA lauded the ministry for detecting the case of polio and precautionary measures taken. The ministry has boosted the surveillance after the outbreak was declared in the Philippines in September. Malaysia's last polio case was in 1992. In 2000, the country was declared polio-free. There are 3 types of wild poliovirus. They could cause paralysis or even death. The world was declared free of type 2 and type 3 of the virus by the World Health Organization. Type 1 is still circulating in Afghanistan and Pakistan. I'm Nanthinee Subramaniam. Thank you for watching.